And a similar situation exists also with the parasympathetic trunk, and we'll talk a little bit more about the parasympathetic division of the autonomic nervous system as we go. Let's talk now about the cranial nerves, and I want to share a little bit of detail regarding the cranial nerves. And I don't know how many of you doctors are actually prepared to do your cranial nerve exam, but from today forward I would encourage you to outfit your doctor's bag with the necessary tools and instruments to be prepared to do cranial nerve exams. Anytime certainly you have a head injury case or a falling, an injured worker who fell maybe and hit their head, or any kind of a potentially injurious situation to the central nervous system calls for an examination of the cranial nerves. So let's talk about the cranial nerves. The first two pairs of cranial nerves, which is the olfactory nerve and the optic nerves, they attach to the forebrain. Okay, and the remainder of the cranial nerves 3 through 12, originate either from the brainstem or even the upper cervical spinal nerve roots in the case of the spinal accessory nerve. And other than the vagus nerve, which is the primary parasympathetic outflow, cranial parasympathetic outflow, other than the vagus nerves, which extend all the way down into the abdomen, the remainder of the cranial nerves serve only head and neck structures. Now, anatomically, if you've ever looked at a model of the skull, and when I was teaching anatomy and physiology at Sacramento City College, we had skull specimens, both actual skulls and model skulls, and so I spent many hours just staring at skulls and trying to get a handle on the anatomy, particularly as relates to the cranial nerves, because the cranial nerves have to leave the skull to find their way into structures in the head and face, and so head, neck, and face. So cranial nerve number 1 consists of tiny sensory nerve filaments of smell, and they run from the nasal mucosa to synapse with olfactory bulbs. And the olfactory bulbs and the olfactory tracts are actually brain structures. And the olfactory apparatus is contained entirely within the skull, with the exception of the nasal mucosa, which is on the opposite side of the cribriform plate. Cranial nerve number 2, the optic nerve, travels from the brain into the eyeball by traveling through the optic foramen, which is an opening within the sphenoid bone. Cranial nerve number 3, the oculomotor nerve, enters the orbit of the eye by way of the superior orbital fissure, and that's an opening between the lesser and greater wings of the sphenoid bone. Trochlear nerve, cranial nerve number 4, same, gets into the orbit of the eye by way of the superior orbital fissure. Cranial nerve number 5, as you recall, has 3 branches. Has the ophthalmic branch known as V1, the maxillary branch V2, and the mandibular branch V3. The ophthalmic branch travels with the oculomotor and trochlear nerves to enter the orbit by way of the superior orbital fissure. The maxillary branch V2 enters the skull to innervate structures of the face by way of the foramen rotundum, also an opening in the sphenoid bone, and the mandibular branch V3 leaves the skull to enter muscles of mastication, to innervate muscle mastication by way of the foramen ovale in the sphenoid bone. Cranial nerve number 6 also passes through the superior orbital fissure to enter the orbit of the eye. Cranial nerve number 7 leaves the skull by way of the stylomastoid foramen. And I hope this is bringing back some of your anatomy to you, even if these names sound a little bit ancient. Cranial nerve number 8, the vestibulocochlear nerve, exits the inner skull by way of the internal auditory meatus, which is in the opening within the temporal bone. Cranial nerve number 9, the glossopharyngeal nerve, exits the skull by way of the jugular foramen, also accompanied by cranial nerve number 10, and also accompanied by cranial nerve number 11, the spinal accessory nerve. The spinal accessory nerve, however, has a slightly different course. It's the only nerve that first enters and then exits the skull. So first it enters the skull through the foramen magnum, and then it exits the skull by way of the jugular foramen, again along with cranial nerves number 9 and 10. And then finally, cranial nerve number 12, the hypoglossal nerve, exits the skull through the hypoglossal canal of the occipital bone. So those are some of the courses and exit points of those nerves. Let's talk a little bit now about the functions of these nerves. Okay, cranial nerve number 1, the olfactory nerve, is responsible for our sense of smell. And sense of smell is a special sensory function. The opposite of special sensory is somatic sensory. And by somatic sensory, we refer to the general sensations such as touch, temperature, pain, pressure, vibration, etc. Okay, smell is considered to be one of the special sensory sensations. The optic nerve, also responsible for the special sensory function of vision. Cranial nerve number 3, the oculomotor nerve, is a motor nerve that innervates the superior, inferior, and medial rectus muscles, and also the inferior oblique muscles. So as you recall, there are 6 muscles are responsible for fine movements of the eyes. The oculomotor innervates 4 of those muscles: the superior rectus, inferior rectus, medial rectus, and inferior oblique. So what does that leave? That leaves the lateral rectus and the superior oblique muscle. Now, the oculomotor nerve also carries parasympathetic fibers. Remember, parasympathetic fibers are craniosacral outflow. So here's our first parasympathetic fibers traveling in the oculomotor nerve to innervate the iris of the eye, and that's responsible for pupillary constriction, and also to innervate the lens of the eye, which is responsible for accommodation of the lens. So those are the motor functions. And if you remember the old mnemonic about the cranial nerves, to determine which of the nerves are sensory and which are motor, I don't know what mnemonic you learned, but we learned the mnemonic, some say marry money, but my brother says be brave, marry Mary. And so therefore the oculomotor nerve, some say Mary. Mary stands for motor. The oculomotor nerve, as the name suggests, is purely a motor nerve. But recall that any time cranial nerve number 6, the abducens, is a motor nerve. It provides motor supply to the lateral rectus muscle of the eye. Also has sensory fibers for feedback control. The facial nerve, cranial nerve number 7, is a very interesting nerve. It's a mixed nerve. It has both somatic and special sensory fibers. Sensory fibers, somatic sensory fibers, in that there are proprioceptive fibers that give feedback control from the muscles of facial expression, and also has special sensory fibers that provide for taste from the anterior 2/3 of the tongue. And taste is one of the special senses. Special senses including smell, sight, taste, hearing, and balance. And so we have special sensory fibers traveling from the anterior 2/3 of the tongue and innervating taste buds. Cranial nerve number 7 also provides for motor supply to the muscles of facial expression, and that's one of the main tests that we use to assess for integrity of cranial nerve number 7, is to have your patient go through the range of facial expressions. The facial nerve, cranial nerve number 7, also carries parasympathetic fibers, autonomic fibers, to glands in the head and neck, such as the lacrimal glands of the eyes, such as the submandibular and sublingual salivary glands. So the facial nerve carries somatic motor fibers, somatic sensory fibers, special sensory fibers, and parasympathetic motor fibers. So carries the full complement of all the different types of nerve fibers. Cranial nerve number 8 is wholly a special sensory nerve. The vestibular division of this nerve is responsible for our special sense of balance and equilibrium, and the cochlear division is responsible for our special sense of hearing. Cranial nerve number 9, the glossopharyngeal nerve, is much like the facial nerve, carries somatic motor fibers to the muscles of the tongue and the pharynx, and that tells us that the tongue is actually skeletal muscle. It carries parasympathetic motor fibers to the parotid gland, which is one of the salivary glands. So 2 of the salivary glands are innervated by the facial nerve. The large parotid gland is innervated by the glossopharyngeal nerve. Glossopharyngeal nerve also carries somatic sensory fibers, somatic sensory proprioceptive fibers from the muscles of the tongue. It also provides for special sensory fibers responsible for our sense of taste from the posterior 1/3 of the tongue. So its facial nerve gives us taste to the anterior 2/3 of the tongue. Glossopharyngeal nerve gives us taste to the posterior 1/3 of the tongue. The vagus nerve carries the full complement of nerve fibers as well. It's somatic motor to the muscles of the pharynx and the larynx. It's somatic sensory, bringing proprioceptive fibers from those same structures, the pharynx and larynx. Carries parasympathetic fibers to the heart, to the lungs, and the abdominal viscera. That is some of the smooth muscle structures of the heart. Well, the heart is cardiac muscle, I'm sorry. But also smooth muscle structures in the lungs and the abdominal viscera. And then also provides for special sensory function, giving us taste from the pharynx. So the full complement of taste sensations are provided for by 7, 9, and 10. And then cranial nerve number 11, the accessory nerve. This is another interesting nerve. Sometimes you'll hear it referred to as the spinal accessory nerve. The accessory portion of the nerve travels with the vagus nerve and provides for motor function to the pharynx, the larynx, and the soft palate, the spinal division of the spinal accessory nerve is motor to somatic motor structures of the trapezius and sternocleidomastoid muscles. And this is a purely motor nerve, with the exception that it does carry proprioceptive sensory fibers from all those muscles back to the spinal cord for feedback control. And then finally, cranial nerve number 12, the hypoglossal nerve, is a motor nerve that provides for provides motor supply to the muscles of the tongue, and also carries proprioceptive sensory fibers from the muscles of the tongue back for feedback control. So let's review a little bit. The special sensory nerves, the cranial nerves that are responsible for our special senses, include cranial nerve number 1 for smell, cranial nerve number 2 for vision, cranial nerve number 7 for taste from the anterior 2/3 of the tongue, cranial nerve number 8 for hearing and balance, cranial nerve number 9 for taste from the posterior 1/3 of the tongue, and cranial nerve number 10 for taste from the pharynx. And finally, those cranial nerves that carry parasympathetic fibers, the cranial portion of the cranial sacral outflow of parasympathetic fibers include cranial nerves number 3, cranial nerve number 7, cranial nerve number 9, and cranial nerves number 10. Those of you that are watching the DVD, or those of you that are using the handout materials for the course, here we have a diagram of the posterior aspect of the brainstem, and it shows the first cranial nerve that we can see in this diagram is the trochlear nerve. Trochlear nerve is interesting in that it comes off the posterior aspect of the brainstem, but then it travels forward. All the cranial nerves below cranial nerve number 4 similarly come off the posterior aspect of the brainstem, but also travel posteriorward. So here we see the facial nerve, cranial nerve number 7. We see cranial nerve number 8 and its branches. We see the large vagus nerve and how it's joined with the accessory portion of the spinal accessory nerve. Note that the spinal accessory nerve has some of its derivation from upper cervical spinal cord levels C1, C2, and even sometimes as low as C3. Here's another diagram for those of you that are watching the video that shows the anterior surface now of the medulla oblongata, showing now we get a good look at the hypoglossal nerve, cranial nerve number 12, and its relationship with vagus nerve nuclei up in the brainstem. Not shown in this diagram is cranial nerve number 11, the spinal accessory nerve root. As we said, that one comes off in this space between spinal nerve number C1 and hypoglossal nerve, cranial nerve number 12. Okay, and just to review, cranial nerve number 1 has sensory function only, no motor function, and no parasympathetic fibers. The optic nerve is responsible for sensory function only, no motor function, and no parasympathetic fibers. Oculomotor nerve is a motor nerve only with some parasympathetic fibers to the iris and the lens. Trochlear nerve is motor function. Trigeminal is both sensory and motor, however has no parasympathetic fibers. The abducens nerve, cranial nerve number 6, is motor only, no parasympathetic fibers. Cranial nerve number 7 is sensory and motor and also carries parasympathetic fibers. And the other nerves that carry parasympathetic fibers are the glossopharyngeal and the vagus nerves. And so it's the facial nerves, the glossopharyngeal nerves, and the vagus nerves that carry the full complement of all 4 different types of fibers. They carry somatic motor fibers, they carry somatic sensory fibers, they carry special sensory fibers, and they carry special motor fibers, parasympathetic motor fibers. The full complement of 4 different types of neurons.